Hi, my name is Rex Clark. I'm the physical therapist at McKinley Health Center, and we're doing a video today to discuss how to use a foam roller and the different reasons where it might come in handy to use it. I frequently see lower extremity diagnoses that may benefit from using a foam roller. People come in with having pain in their glutes, their thighs, their calves, and so using the foam roller may be part of their treatment. So now let's just go to the gym and we'll show you examples on how to use the foam roller. So this is Sammy. She's graciously volunteered to help out today to show us how to use the foam roller. What we're going to start today is to roll the IT bands, which run down the side of the thigh and also front of the quads, and then do the other side. So go ahead, Sammy. So she's starting up at the hip. You can stay below this bone right here because that might just be a little more painful. And then roll down all the way almost to the knee. And so the next thing she can do is rotate about 45 degrees to the floor, her torso. Just cover the same area. So if you have a sore spot, if you find one, then you can just kind of stay there and just oscillate back and forth just to kind of work that out. And then the next step that she can do is to go face down into a plank position. A lot of times people will tense up and their toes will be off the floor just because it's a defensive mechanism. It doesn't hurt as much like this. But if you really relax your quads and let your toes drag, then it'll dig in and may feel better. It'll certainly be more pressure and it may hurt a little bit more too. So we've done the IT bands, the lateral part of the quads, the front of the quads, and now we just simply switch legs and do the other side. All right, so here's Sammy doing the IT band. Oh, all of a sudden she realizes it hurts a lot. She can't stand it. She wants something a little bit less painful. So what you can do is put a pillow here underneath. It gives a little bit more cushion, and hopefully that won't hurt quite as much. Sometimes people have pain along the inner part of their thigh that the foam roller may help in rolling out. So Sammy will go ahead and get down. I'll help position the roller. Usually I tell people to get perpendicular to the thigh, and then she can just kind of rotate back and forth. So it's really getting the inner part of her thigh. She can go all the way down close to the knee. A lot of times it's more tender down here, and people can just kind of oscillate back and forth. We can also use the foam roller to massage the calves. A lot of times the calves get quite tight, and it helps to kind of massage them out. A lot of times I'll see people do this, which is fine, except it's a lot of work. What I tell people is another way, and that's just to put one foot on the other just to get a little extra weight, and then you can bend the right knee back and forth. Inner part of the calves is more tender, so if you kind of rotate a little bit more, a lot of times that area will be a little more tender. And if you have a sore spot, then you just simply rotate that leg back and forth over that sore spot. We can also use the foam roller to roll out the glutes. Sammy's going to just position herself so that's pretty much in the middle of her right glute. She can just roll back and forth. It's not going to be a big area that she's going to roll. Now she puts her right ankle on her left knee. That will put those muscles on a little bit more tension, and this may hurt a little bit more. Foam rollers come in a lot of different sizes and shapes. I have 5 examples of rollers or sticks that people use. This one here is a 36-inch long, 6-inch diameter. This is very common, probably one of the more reasonable ones, and it does a fine job in most cases. This one has pretty firm things sticking out, and this is a lot more brutal, and it will hurt more usually. This is kind of an acquired taste. Usually I'll tell people to start with this one, and if they really like it, then after a while they can progress to this one. This one is just simply a third of the size of this one, so it takes up less space, it's more portable, and it's cheaper. This is one I like also. It has hills and valleys, and the way you position it, it can really dig in a little bit differently, give it a little different feel than just the straight edged one here. And then finally, if you're going somewhere, just have no or very little space, this is just one example of a roller stick. You can just roll up and down. I tend to tell people to use something like this first, because once they commit their body weight on top, then probably be a little more effective. Here, if people use it and it starts to hurt, then they may not dig in as much. There are situations when you might not want to use a foam roller. For instance, if you have weak bones or bone density issues, Certainly if you have a recent fracture, balance issues, or if you're not sure, just ask your PT, athletic trainer, or doctor, and they can help you with that.